My name is Charissa Levy, and I'm Executive Director of the Toronto Acquired Brain Injury Network. And we're fortunate to have the Ontario Neurotrauma Foundation represented as an ex officio member on our advisory committee. The Toronto ABI Network is comprised of 20 organizations that provide acquired brain injury services, both hospitals and community-based organizations from across the Greater Toronto Area. So there are two key areas of focus for the Toronto ABI Network: system navigation and project management, with shared initiatives across our member organizations. And ONF has really helped the ABI network from these two perspectives. One, from development of clinical best practice guidelines. They help to outline what should we all be striving for together as providers, so we have that foundation. We know where to start, where we're going, and they've also created resources for patients and families that are helpful to us as we provide system navigation as part of our mandate. In terms of the greatest contribution of ONF over the last 20 years, it's a big question, hard to answer, but I would say definitely the development of best practice guidelines, certainly while labor intensive, are extremely important, both from benefiting public and private sector providers, so that we all have a shared understanding of what we should be striving towards and what we should be providing from a gold standard best evidence perspective. And I would also say the research that the Ontario Neurotrauma Foundation has funded. Brain injury is often known as the invisible injury, both from an individual's perspective and from a system perspective. And the research, the neurotrauma research, has really helped to bring that to the forefront. And in particular, helping to identify the prevalence of brain injury in populations where perhaps we didn't have as much information on the existence of brain injury. So, for example, in individuals that have mental health issues, addictions issues, the homeless population, and individuals who may have involvement with the justice system. And lastly, my hope for the Ontario Neurotrauma Foundation after 20 years is continued to be a go-to centralized resource for providers in terms of best practice evidence, and collaborate, as they continue to do, with organizations, brain injury health service providers, spinal cord injury health service providers, to help inform policy and use that evidence and best practices that and the research that they fund, so that we can identify how we need to perhaps change or even develop new policies to continue to impact the lives of individuals with neurotrauma.